Dozens of new cases of coronavirus are being confirmed in the UK every day. The number of deaths is also slowly increasing. Questions about whether the NHS can cope are now being asked as officials defend the government's decision not to follow Italy into lockdown yet.
At the moment, the modelling and the science behind it suggests that that mechanism of self-containment, if you like, when we start to see a large rise in cases, and looking after the elderly, and we will expect to give more specific advice on that in a little while. Those are the two measures which currently would maximise the safety of the population and minimise having a very big peak, and also the associated disruption, if you like, to businesses and to how people go about their daily lives.
Today, a sixth person who had underlying health issues died from the virus at this Watford hospital. 54 more cases have also been confirmed. Amid criticism, GPs don't have the personal protection equipment they need. The government had this response.
We now have rolled out PPE to 2/3 of primary care, and the rest of it is in progress. So we will absolutely address this. It's quite right that we did. We wanted to get the timing of the rollout right so that the equipment is there should this epidemic hit in a very large way.
Despite that promise, this London surgery is still without.
Key things that we're missing is the personal protective equipment. We don't have any.
Do you think then the government's failing GPs?
I wouldn't say failing, but I think the equipment that we are supposed to be using, the PPE equipment, and maybe giving us more support, maybe giving us more resources, probably we could do with those sooner rather than later.
It's not just primary care that may need help. In England, there are currently just over 4,000 intensive care beds. On average, around 75% in England are occupied at any one time. That percentage is even greater in Scotland, Northern Ireland and Wales. A report 2 years ago found that 40% of critical care units had to close beds due to staffing shortages on a weekly basis.
I think it will be very challenging. It's not possible today to predict exactly how challenged we will be. It's clearly going to be concerning if we have staff that are self-isolating or staff that are unwell. We know that that will be an additional pressure, but we do have plans in place to stop non-essential or non-emergency services to release capacity so that we can put it where we need it.
Tonight, a member of staff at Great Ormond Street Hospital came down with the virus, forcing it to postpone some non-essential procedures. The impact it has on the NHS has clearly only just begun.